This is a mitochondrion. You may have heard mitochondria referred to as the powerhouse of the cell. But did you know that even when they are functioning properly, mitochondria can be the reason for a cell's death? This is because mitochondria are instrumental in initiating a cell signaling cascade that leads to apoptosis, also known as programmed cell death. Cells use apoptosis to die in a controlled manner when they're overcrowded or extraneous, compromised by an infectious agent, or otherwise dysfunctional. As part of the signaling cascade for apoptosis, mitochondria release several different proteins into the cytoplasm, including the second mitochondrial activator of caspase, often abbreviated as Smac. Caspases are a family of enzymes that act like molecular scissors to dismantle key cell structures such as the cytoskeleton, leading to apoptosis. Smac activates caspase by binding to inhibitor of apoptosis proteins, or IAPs, a family of proteins which work to keep caspases locked in the off state during a cell's life. This binding by Smac to IAPs can either free caspases, leading directly to apoptosis, or degrade IAPs to activate the NF-kappa B signaling pathway, which can promote apoptosis. IAPs are often overexpressed in cancer cells, leaving their caspases and NF-kappa B pathway relatively inactive and making apoptosis practically impossible. This allows tumors to grow unchecked. After this was observed, the idea for a new class of anti-cancer drugs known as Smac mimetics was born. As the name suggests, these drugs would restore apoptotic function by mimicking Smac, which normally promotes apoptosis in our cells. Initial work on these compounds was spearheaded at the University of Texas Southwestern Medical Center, which produced a mimetic that killed cancer cells in the lab with ease at low concentrations.
Based on this promising foundational work, another Smac mimetic, LCL-161, was developed by Novartis Pharmaceuticals, who hope to use it in humans. Thankfully for them, preclinical results showed that LCL-161 sensitizes cancer cells to apoptosis, leading to a human trial for the drug in myelofibrosis patients. Myelofibrosis is an aggressive and rare cancer of the red bone marrow responsible for producing red blood cells, where bone marrow is replaced with functionally inert scar tissue. Symptoms of this cancer are anemia, the lack of red blood cells, and enlargement of the liver and spleen, two organs that are important for blood filtration. In Phase 2 of the clinical trial involving myelofibrosis patients, LCL-161 was administered orally once weekly. IAP level reduction was observed in all patients in the trial, confirming the mechanism of action of LCL-161. By the end of the trial, more than 30% of participants showed clinical improvement of symptoms. What's more, 13% showed improved anemia responses, which is a huge milestone as anemia greatly contributes to the fatigue and difficulty breathing in myelofibrosis patients. The overall survival rate of patients involved in the trial was 34 months, compared to the 13-month average survival rate for the currently approved myelofibrosis drug, a marked improvement. But that doesn't mean it came without side effects. Nausea and vomiting occurred in 64% of patients, and 1 to 2 days of fatigue after the dose was also common. Both of these are associated with cytokine release syndrome, an aggressive immune response to therapeutic agents, which at its most severe can lead to organ failure and death. This level of toxicity was encountered in one of the patients involved in the trial and was used to set the maximum safe dose that would be given to the patients.
As of 2022, there are a total of 10 clinical trials for LCL-161 that are either in progress or complete. Most of them are studies of the safety and efficacy of combination therapy, where LCL-161 is used alongside another chemotherapy drug that we already know works, hopefully bringing the anti-cancer benefits of both drugs to the patient.
And there are still loads of potential for the improvement of LCL-161, such as lowering the dose to combat toxic side effects, like cytokine release syndrome, while developing methods to maintain or improve the drug's efficacy. Nonetheless, LCL-161 and other Smac mimetics are a promising novel method for treating cancer that may one day save many lives.